In this video, we're going to talk about the spine and how it functions. If you're experiencing neck pain or back pain and trying to figure out what's causing it or what you can do about it, a good starting point is to understand the spine itself. So that's what we're going to do. So Mike, come over here. So here we have the spine. And you can see right here, this is the base of the skull. So inside there sits the brain, and all the nerves are derived from the brain, and they go into the spine itself. They go all the way down into the spine, all the way down to the tailbone. And you'll see that at every single level, these yellow areas here, this is representing the nerves. So you'll see that the nerves come from the brain into the spine itself, and then at every level, one nerve exits on the left and one nerve exits on the right. And so we have the vertebrae, where the nerves exit in between each of the vertebrae. So we actually have 7 vertebrae in the neck, and then we have 12 vertebrae, which are called thoracic vertebrae. They're in the upper and mid torso, and then the lowest 5 vertebrae are the lumbar vertebrae. And then you have the tailbone down here, which is the sacrum and the coccyx. So what happens is, as the nerves exit at each of these levels, they go down to a specific area of the body. So the cervical vertebrae, the nerves that exit from each one of them go to the neck, into the shoulders, and down the arms. The ones that exit at the thoracic vertebrae go into the upper and mid to lower torso. And then the nerves that exit through the lower 5 vertebrae, which are the lumbar vertebrae, those go into the hips and the legs all the way down to the feet. All right, thanks, Mike. So what is the function of the nerves themselves? So the function of the nerve, there's 2 main ones. The first is to give power to the muscles. So when you want to contract a muscle or move, the brain sends a signal down through the nerve to that muscle. And the second function is to give the skin sensation. So it's kind of like an alarm system. So if you, let's say, sprained your ankle, or let's see, you were getting a burn on your ankle, or it was being overstretched, the body wants to tell the brain, hey, something's going on down here, so there may be damage that can occur if this continues, or maybe telling it there's damage already. So it's kind of like an alarm system for the body to tell it that something needs to change down there, there's going to be a problem. So that's basically the structure of the spine and how the nerves relate to the body. Now what we'll do is, let's take a closer look at one segment of the spine and the vertebrae themselves. For that, we'll use a different model. So now we're getting a close-up view of 2 of the vertebrae. So you'll see how each of the vertebrae are separated by this disc here. Now what this disc does is it's a weight-bearing surface for the vertebrae. It helps to absorb shock. So if you were to jump and land, it will help to cushion the landing, to absorb the shock, because you wouldn't want 2 bones just compressing on each other. That would cause an issue. The other great thing about the disc is, if I'm standing this way, if I lean to the side, it will conform to that motion. If I lean to the other side, it conforms that way. If I lean forward, it can conform. So every direction, and even through rotation. So that's the function of the disc itself. Now, you'll also see, if I turn this on its side, you'll see how there's a hole right here in the middle of the vertebrae. That's where all the nerves go. They come straight down that, and they go all the way from the top of the spine by the neck, all the way down like we said before. So there's this nice area for all the nerves to travel. And the other thing we said was, at every level the nerve exits. So in between the 2 vertebrae, it forms this hole right here, and that's where the nerves exit out of. And the only area where the 2 bones are actually joined together is at this facet joint. There's one on each side, and it's surrounded by ligaments and capsules. Well, the next question is, what's causing pain? Well, there's several structures that can actually cause pain if there's injury to them. So The disc itself, if there's any type of injury to the disc or to the ligaments on the back side of the disc, that will give you pain. If there is any type of injury or trauma to the bone, that can also cause pain. This right here is the nerve root. So this is where the nerve exits, like we said before. If there's any pressure on there, that as well can cause pain. Any blood vessels inside that are having an issue causes pain. And then the facet joints here, as we spoke about before, the only area that actually adjoins two separate vertebrae, if there's injury or trauma or stress to the ligaments and capsules around those two joints, that can also cause pain. So now you know, if you're having pain in your neck or your low back or anywhere in your spine, it's one of those structures or the muscles that are sitting on top of the spine that are causing the pain and have some type of issue going on. And now what you need to do is look at what is causing that. And what causes any of that pain is when the spine moves out of the natural alignment that it wants to be in. And so in the next video, we're going to look at the natural alignment of the spine and what causes you to come out of that alignment, which causes the pain.